Everyone, what do you do when anxiety or disorders appear in your life? I want to eliminate the painful things. It shouldn't happen. Do you often think that? There is a big difference between Western medicine and Eastern medicine in their approach to anxiety and disorders. The Western way of thinking, which is the axis of modern medicine, tries to control and remove anxiety and disorders. On the other hand, the Eastern way of thinking tries to think about why it happened and accept the anxiety and disorders. In other words, it means being yourself, including your anxieties, symptoms, fears, and conflicts. Eastern psychotherapy was created in Japan at the same time as psychoanalysis. Its name is Morita Therapy. Morita Therapy is a unique psychotherapy for neuroses, founded in 1919 by Shoma Morita, a Japanese psychiatrist. This psychotherapy has been highly effective in the treatment of interpersonal phobia, obsessive-compulsive disorder, and anxiety disorders. More recently, Morita Therapy is said to be effective in a wide range of areas, including mental care for chronic depression and cancer patients. Morita found that a variety of neurological symptoms arise against a background of what he called Shinkei-shitsu personality, characterized by introverted, self-centered, anxious, timid, sensitive, and perfectionistic tendencies. Morita believed that the psychological mechanism he called toraware operates on the basis of these personalities to produce the symptoms. There are two aspects to this toraware mechanism, which Morita named seishin kougosayou and shiso no mujun. The first, seishin kougosayou, refers to the vicious cycle of sensation and attention, which is increased by focusing on fear and discomfort. The second, shiso no mujun, occurs when the experience of fear or discomfort is real, but one makes an unreasonable effort to erase it. The idea behind Morita Therapy: death is inevitable for human beings. In Morita Therapy, the desire for life exists behind the fear of death. It means that the mind that harbors fear of death also harbors a desire to live a constructive life. Therefore, Morita Therapy encourages the patient to stop struggling with anxiety and fear of death, and instead to engage in constructive activities that fulfill a true and healthy desire for life. There are several key words that are important to understand Morita Therapy. Arugamama is also an important word. This is often understood to mean to be natural, or to be as one's true self. However, arugamama used in Morita Therapy has a different meaning. Arugamama means a change of direction from a mood-dominated state of mind to an action-based, purpose-driven way of life centered on doing what needs to be done. Guiding principles of emotion. Shoma Morita stated that emotion is a phenomenon dominated by 5 laws or principles. 1. Emotions, if left untouched, form a mountainous curve and disappear after climbing to the top. 2. Emotions suddenly quiet down and disappear when the impulse is satisfied. 3. Emotions become dull and insensitive when they become accustomed to the same sensation. 4. Emotions are stronger when the stimulus is continuous and when attention is focused. 5. Emotions are learned by new experiences and become more and more developed through repetition. In other words, emotions are not something you can control. Desire for life. The concept of desire for life is fundamental to the theory and practice of Morita Therapy. It is the constant desire of human beings to live better. By nature, people wish to live well, to be respected, to be important in the world, to keep healthy, and so on. These are feelings that every healthy person has. Behind those desires, however, is unpleasant psychological energy such as fear and anxiety. We call this fear of death. The desire for life and the fear of death exist in the spirit as two sides of the same coin. Here is an example of treatment with Morita Therapy for social phobia. Mrs. B, 34 years old, female. Treatment method: outpatient, diary guidance. Main complaints: stiff face when speaking, difficulty making eye contact with others. Mrs. B entered college after the age of 30. She became nervous before her presentation. Her face scrunched up during the presentation, and she felt disrespected by others. When the therapist asked her about her feelings at the time, she said she was scared, embarrassed, and ashamed. The therapist informed her that behind these feelings existed the desire to be better than others, to be recognized, and to seem good. The therapist also pointed out that trying to avoid nervousness is in fact increasing nervousness. She repeatedly mentioned that she gets nervous in various situations, both in interviews and in her diary. She said, "I feel ashamed that I can't even greet people naturally." The therapist pointed out her attitude of trying to forcibly control her emotions and facial expressions. The therapist then instructed her to evaluate her actions, not based on whether or not she was nervous, but on whether or not her primary goal had been fulfilled. Eventually, Mrs. B's diary entries began to show her taking the necessary actions while being nervous and flustered. Mrs. B said she feels that if she continues to take action despite her nervousness, she will be able to achieve her dreams for the future. Finally, we concluded the treatment with a promise to conduct additional sessions if she wanted to. This was an example of a patient who had entered a vicious cycle by focusing on shame and tension, but whose life was turned around by taking action with discomfort after finding out her desire for life. How was it? In this way, Morita Therapy teaches you to live with anxiety and act constructively from what is necessary in your life. By nurturing the mind of arugamama, the main goal is to overcome symptoms and anxiety. In other words, it can be called reorientation of human beings.